Hello friends, welcome to my channel Neurology Videos Learn by Seeing. Today we will discuss about Alzheimer disease. I will give you 10 important points about Alzheimer disease, and these are very important points. First, we know that Alzheimer disease it affects the cognition of the patient. We know that in Alzheimer disease it follows a characteristic pattern. We know that it affects the memory of the patient. So in Alzheimer disease, memory it is affected earlier than the language and the visuospatial pattern, and it is executive dysfunction it is seen last. So if you question is asked, what is the characteristic pattern which is seen in Alzheimer disease? Answer is memory is the earliest, then language and visual spatial function is lost, and executive dysfunction, that is reasoning, it is affected last. Second is, what is mild cognitive impairment and what is the importance in Alzheimer disease? So what is the definition? That is, when memory loss, when you are doing the normal memory test in patients with dementia, when you are doing the normal memory test, if the memory loss it falls 1.5 standard deviation below the normal, then you say that this patient has mild cognitive impairment. And 50% of these patients with mild cognitive impairment, they will progress to Alzheimer disease, and the rate is 12% per year. So what is important of MCI? That is mild cognitive impairment. That is, these patients, they are at high risk of progressing to Alzheimer disease. So their rate is 12% per year. So what is third question is, what is prodromal Alzheimer disease? How you can pick Alzheimer disease in prodrome? So answer is, you can do the PET scan, other is a CSF. This is the new question. This is a recent question. What is prodromal Alzheimer disease? You can do the PET scan of the patient. In PET scan, amyloid imaging positive can be seen, and in CSF you can see for A beta 42, and mildly tau positivity can be seen in Alzheimer disease. So remember, Alzheimer disease is also a tauopathy. Okay, now very interesting question is in language, which is the earliest change. You can see that in Alzheimer patient, naming is affected first, but earlier than naming, it is a word finding and circumlocution. So even before naming is affected, it is a word finding and circumlocution which is affected first. So what are the various things which are affected last? That is, even in the late stages, which are the things which can be seen which are affected last? That is loss of judgment, reasoning, gait. These can be seen, these are affected later on in the Alzheimer disease. What is the typical duration of Alzheimer disease? It is 8 to 19 years. So if the natural history of Alzheimer disease is asked, so answer is 8 to 19 years is the duration of the illness of Alzheimer disease. Now we know that what are the various lobes. It is a frontal lobe, parietal lobe, temporal and occipital lobe. So now neuroimaging in Alzheimer disease, which lobe is affected first? It is a temporal lobe, and it is a medial part of the temporal lobe. Atrophy will begin in the medial part of temporal lobe, then it will progress to parietal lobe, and lastly then it will involve the frontal lobe. Whereas in frontotemporal dementia, it will mainly affect the frontal and temporal lobe. Now next important dementias, that is the dementia with Lewy body. What is the characteristic part? It is a early Parkinson with visual hallucinations with delusional misidentification syndrome. Now if a patient has rapidly progressing dementia with rigidity, with myoclonus, you can suspect Creutzfeldt-Jakob disease and Hashimoto's encephalopathy. Okay, this is very important MCQ, very important differential. That is a rapidly progressive dementia with myoclonus. Always suspect CJD, always suspect Hashimoto's encephalopathy. Always do imaging. If you get cortical ribboning, this is important diagnosis, CJD. And in frontotemporal dementia, which part of the brain is affected? frontal and temporal. So in history, instead of getting the memory loss, that is, patient does not give the history of amnesia, patient does not give history of dementia, that is, there is no history of memory loss. Major history is prominent behavior change, intact navigation. Patient have focal atrophy of frontal and temporal lobes. Thank you. Hello friends, welcome to my channel Neurology Videos Learn by Seeing. If you're tuning to this channel first time, subscribe it to get the maximum neurology videos and do press that bell button to get the notification of each and every video.